Hi everyone, this is Dr. Quest, the MD and a PhD candidate in the Internal Medicine Department in one of the teaching hospitals in the Netherlands, and welcome to my channel. So yeah, I've got a course before, or I've got some channel before, so perhaps you recognize the voice. So now I'm starting a new channel where we're going to be reviewing high-yield questions for the USMLE exams. So we're going to be reviewing 2 questions per section, and we're going to do that for every systematic review, starting from the most high yield. We know now the biochemistries, the ethics, and so on are the major ones that you see a lot in the recent exam. So we're going to start with biochemistry, and then we are going to work our way down based on the high yield questions. So yeah, we're going to do 2 per question. So let's get started. We're starting biochemistry today. We are going to do question 1 and question 2, and then proceed to other videos. So if you will find this valuable, make sure you like it, and you subscribe, and you let me know in the comment section if you have a question, if you've got some recommendations to make. I'll be happy to hear them. I'll also attach if you want to take the course already, because I've done all the reviews for the systematic review, the random reviews. I have them in a course. If you want them directly for the exam, you let me know in the comment section. I will also tag the link to my website in the comment section for you to be able to do that. So now I'm going to cut away from my face so we can focus on the questions, and then just walk you through the one that is the right answer, why the other ones are the wrong answers, and so on and so forth. So this is question 1. For question 1, if you remember the concept that I brought up, that I used to use 1, 2, 3, 4, where we start from the bottom. So we say, which of the following is the most likely diagnosis? That's the main question here. Which of the following is the most likely diagnosis? Then we go to the top. A 24-year-old man presents with cough, chest discomfort, and exertional dyspnea. Cough, chest discomfort, and exertional dyspnea. That's already telling you this is likely some sort of mass, or some sort of something that has to do with cancer, right? Because you have cough, chest discomfort, and exceptional dyspnea. Cough, chest discomfort. So you're just making differential diagnosis, right? Because TB could be there, but right here, look at, he lost a lot of weight, and he smoked 1 pack per day and drinks on weekends. Smokes 1 pack per day and drinks on weekend. Then the 3 starts from the physical exam, instrumental exam, okay, biopsy, and so on. So you have 1 at the bottom, 2. The gender, the age, the ethnicity if it's added, 3, the main complaints, which is cough, chest discomfort, and exertional dyspnea, and 4 starts from physical exam, instrumental exams. Everything in between is usually quite important as well, but it's just, this is just adding to the first point, which is smokes, lost weight, cough, chest discomfort, and exertional dyspnea. Now look at where it's very important here. The physical exam, instrumental exam, biopsy are the ones pointing specifically to the answer, to what they need the answer to be. So chest imaging shows a large anterior mediastinal mass. So there are a handful of anterior mediastinal masses, there are a handful of middle mediastinal masses, and there are a handful of posterior mediastinal masses. So it depends. Now you would need to know what mass belong where. At least the first or the second one are very most popular in these locations for the exam. Yeah, because the exam is all about memorizing a lot of concepts that you would need to call up immediately, because you only have about 1.5 minutes or so for every question. So they now say the test reveals elevated beta HCG and alpha fetoprotein in the mass. So what is the likely diagnosis? Okay, so this is an anterior mass compartment, and anterior mediastinal mass compartment are usually 4 etiologies. So they call them the 4 T's. The 4 T's. They are usually called the 4 T's. 4 T's. Anterior mediastinal mass. So the 4 T's are your thymoma, your teramoma, your terrible lymphoma, and your thyroid neoplasia. Thymoma, teramoma, terrible lymphoma, and thyroid neoplasias, they are your anterior mediastinal masses. Thymoma is a neoplasm. Lymphoma, terrible lymphoma, Then you've got your germ cell tumors. Your germ cell tumors, which is your teratomas. Your teratomas, they are your seminomas, seminomas, but teratoma is the main one you need to know for the non-germ cell tumor. So when you think about anterior mediastinal masses, think about 40. So it has to be one of them: thymoma, teratoma, cerebral lymphoma, and thyroid neoplasm. Thyroid neoplasm. Okay, so those are the ones for the anterior mediastinal mass. For the middle mediastinal mass now, which is good to also know, so that you can make the best differential diagnosis based on the location. You know, this one is located, if you have in the middle view, the anterior mediastinal mass mostly influences the structures such as the thymus and the lymph nodes. That's where we get the 40s. The middle mediastinal mass influences the location of the heart and the great vessels, the pericardium, a bit of the lymph nodes as well, but you have more structures in the middle mediastinal mass, like the trachea, the bronchi, the esophagus. So, fittingly, the masses as well will be related to these structures. So you have things like pericardial cysts, bronchogenic cysts, vascular masses, esophageal tumors. You also have the lymphadenopathies like sarcoidosis, lung cancer, sarcoidosis. They are all middle mediastinal masses. Cysts from the pericardium, bronchogenic cysts, esophageal tumors. They are all middle mediastinal masses related to the structures in the middle compartment. While the posterior compartment is usually your vertebrae. Of course, if you're looking at the back now, we're talking about the vertebrae, the neural tissue, and the lymph node. Vertebral neural tissues and the lymph nodes. So you have your neurogenic tumors like your schwannomas, your neurofibromas, your meningocele, and things that has to do more with those structures in the posterior compartment. So going by this general information, they tell us this is a large anterior mediastinal mass. We say the 40s, right? So you see, you have benign teratoma, which is the first one here. But from what we said it's thymoma. Remember, thymomas, teratomas, non-seminomatous, and non-seminomatous. Your teratoma is in your anterior compartment. Your bronchogenic cyst, which is the second one, is in your middle compartment. Your Hodgkin's lymphomas, based on the location of the vessel and the involvement of your lymphomas. Hodgkin lymphomas is a lymphoma, right? So it's in the anterior and the middle compartment. Your non-seminomatous germ cell tumors and the seminomatous germ cell tumors. These ones as well are located in your anterior compartment. Seminomas and non-seminomas. Seminoma as well is in your anterior compartment, and your thymomas as well is in your anterior compartment. So based on this, we see there are a lot of the ones that are given. They are also in the anterior mediastinum. They are also in the anterior compartment. However, they've already tell us that there is also elevated beta HCG and alpha fetoproteins. Beta HCG and alpha fetoproteins, among those which are in the anterior compartment, is pointing specifically to your non-seminomatous germ cell tumors. Your non-seminoma, your seminomatous germ cell tumor, which makes non-seminomatous germ cell tumor the answer. Okay, non-seminomatous germ cell tumor is the one that has beta HCG and alpha fetoproteins which are elevated. Beta HCG and alpha fetoproteins which are elevated. Beta HCG and alpha fetoproteins which are elevated. So this is not a thymoma. Based on the location as well, this is not saying it's a thymoma. It's not and usually, again, if we talk elevated alpha fetoprotein and beta HCG, it's usually 85%. Majority of 85% in cases in most patients. Remember, non-seminomatous germ cell tumor is what you want to particularly remember. Teratomas, they are usually benign and they don't have alpha fetoprotein and beta HCG. Bronchogenic cysts, these ones, they are congenital cysts that usually arise due to abnormal development of the bronchopulmonary foregut. bronchopulmonary foregut. Your Hodgkin lymphoma is the lymphoma, it's anterior middle compartments, fever and night sweats, just like very looks more like the TV. There's no elevated alpha fetoprotein or beta HCG. Then you have your seminomas and your non-seminomatous situation. Seminomas as well might have beta HCG, but it's usually in the minority of the cases. The majority of beta HCG and alpha fetoprotein is your non-seminomatous germ cell tumors. Then you have your thymomas. Thymomas are usually the common cause of anterior mediastinal mass. Common cause is thymomas, but thymomas don't have alpha fetoproteins or beta HCGs. They do not have alpha fetoproteins and beta HCGs. Thymomas are usually related to your paraneoplastic syndromes, such as myasthenia gravis. Paraneoplastic syndrome, such as myasthenia gravis, is your relation with your thymomas. So this makes this 85% of the time is the cause that you have elevated beta HCG and alpha fetoprotein. Non-seminomatous germ cell tumor, your answer. So let's look at the second question for this review. We start from the bottom quickly again. Which of the following method is best to determine if the gene is being transcribed in cultures of the isolated cells? What method is best described if gene is transcribed? Transcription of gene. A mutation in a non-coding DNA sequence is suspected to affect expression of the gene encoding a specific fetal enzyme. Encoding specific fetal enzyme, liver bone marrow cells from the fetus and its patients are obtained. Which of the following method is best to determine if the gene is transcribed in culture of isolated cells? Transcription. So usually when you hear about transcription, when they say gene is undergoing transcription to analyze the presence of its mRNA it's usually a situation of mRNA non-coding DNA sequence being transcribed. It's usually talking about the northern blot, which means the northern blot, our answer. Transcription, mRNA from a DNA template, etc. Production of mRNA from DNA templates, we are usually talking about northern blot, because it is a test that detects specific mRNA sequences. If we talk about western blotting, it's usually used specifically to detect complete gene expression, failure of gene expression. A situation where you have a gene that cannot express itself because it fails to produce protein, then it is western blotting. Okay, western blotting. That's usually the situation that involves western blotting. A situation that involves western blotting. Southern blotting and southwestern blotting, both of them together, they are usually used to detect the mutated DNA sequences in most cases. Detection of DNA sequences, mutation of mutated DNA sequences, and to access transcription factor binding. But usually, mutated DNA sequences, you think about your south and your southwestern blotting. And ELISA, which is enzyme linked immunosorbent assay, we know it's usually a test that is common to use to measure the amount of protein in bodily fluids. So if you're talking about measuring plasma insulin, plasma levels, and so on and so forth, then you think about ELISA. So in this situation, mRNA production from DNA, non-coding DNA sequences, transcription process is your northern blot. So yeah, that's about it, ladies and gentlemen, for this video, and we're going to continue with the other two questions in the next video. So subscribe, like, share with somebody. We are going to pile it up in this format. So I realized breaking it into small sections, tiny sections, makes it even easier to absorb and easier to remember. So please subscribe to the channel. Let's get the biochemistry section quickly over in the next coming days, if not weeks. So yeah, I'll see you on the next video.